We're all going to do some recording, so get your phone, look for a recording app. Hopefully you, from before, you have downloaded one. I use Smart Record, but there's lots and lots of them. They don't cost anything. If you don't have anything, you can use just the selfie video app, and that will record you and your voice too, so you can listen back to yourself. It's a great way of being critical about your speaking, improving your speaking, and all that sort of stuff. So you know, we sometimes you can't get a partner, so you can have a bit of a look, you know, and try yourself. Christian just said about, well, my student was in Scotland, Christian. I don't know where you are, and her 27th of June was cancelled. So yes, definitely, this class is for absolutely everybody, doctors, nurses, any medical profession. You know, it's the same thing. You'll see that the speaking tasks are either for nurses or doctors, and they alternate each week. So if today's for that one, the other week will be the next one, and that's, but we only unfortunately have tasks for those two careers. But it's the same, exactly the same in the long run, the analysis and everything we do. So, wow, our warm-up, which is 5 minutes. So you go into the room there and you check your ID and your profession. There's a short warm-up conversation with the interlocutor. Now, we're often talking about our blogs. We've got the E2 language blog, but the OET, not blog, I was just about the YouTube page, the OET YouTube channel has full video of a full speaking task. So from the beginning right to the warm-up, the first discussion, and then the second one. You can find them on the YouTube channel. So we've got just a little bit of a summary, I'll talk about the end also. So you've got blogs on the E2 language blog, full of very interesting articles and information. But we've got the YouTube, the E2 language YouTube channel. But here I'm talking about the OET YouTube channel, and you can find that very, very clear. It's with the sort of the head of the OET, Rebecca. Well, not the head, but you know, she's sort of the person who's there and having that. So you can see how an official speaking test works. So those warm up for 5 minutes. Then we've got 2 role plays. All in all, they're 8 minutes. So we've got 3 minutes for preparation time, and then the role play lasts 5 minutes. And then you have 2 separate cards. So how do we start? Well, there's a warm-up conversation with the interlocutor. You know, it's not assessed, it's just, they're going to greet you when you enter the room. They're going to ask your name and your ID. They're going to ask you some basic questions. I mean, it might be 1, it might be 2, things like, where are you from? How many years have you been a doctor or a nurse or a podiatrist? How many, or why did you choose to become a physio? What do you think makes a good dentist? So whatever you are, they're going to ask you that type of question. So think about it beforehand. They're not assessed, of course, but it's good to get off, you know, in a good way. And then, of course, your interlocutor is going to play the part of the patient. Or sometimes it's even a relative of the patient for those people. You know, someone who might come in with a child or come in with an elderly person, you know. So one of the things we need to think about is, how do we address that patient? Well, the easiest way, of course, and the most natural, is to use the name of your interlocutor. They'll introduce themselves. You can ask the interlocutor which name they would like you to use during that preparation time, which I mean before the role play starts. You can choose a name for the patient and use it at the start of the role play. The interlocutor will accept this, of course, respond to it. So, you know, you might have a thing like this, that they'll say, good morning, or hi, my name is Marla. Hi, Marla, do I use your name as the patient's name? Yes, that will be fine. So during your role play, then you're going to sort of introduce us. Hi, Marla. Oh, so Marla, I understand that you've been experiencing some back pain. Look, every time it's different. Sometimes you need to ask the patient for their names. You want to ask them their name. I have your name, please, especially in situations like A&E. Remya, someone's just come in, better late than never. Good girl, thank you for coming. You know, you need to ask the patient's name. Sometimes you know it. There's all sorts of different situations, and I'm going to focus on that each lesson. So here we're actually in the hospital. We're in the children's hospital ward. So, you know, straight away, you're going to be talking with the patient's parent. You know, and don't forget, it's gender, let's say gender neutral. So if your interlocutor is a man, you'll be talking to the father. If it's a woman, you'll be talking to the mother. So that sort of thing, how it works. So what we need to do, and I found that in some of the mini mock tests I've been doing, the people who do well, it's not only because their language is good and all that sort of, but they have, let's say, the people who don't do well are the ones who very often haven't got their head around what's going on in the card or on the card, which means in the situation. So the way you prepare your task is really important, because it can really mess with your fluency, with the organization of what's going on. The feel that, you know, you're speaking confidently. So you need a system in those three, and it's quite, you know, nerve-wracking first 3 minutes, that you can clearly get your head around what's going on in your situation. Of course, you have the card, you can write on it, you can underline things, you can add notes, which does help. But first things first, we need to think about where the consultation is taking place. We need to think about who the doctor is speaking with. How old is the patient? Here we've got a different thing. Is there a diagnosis established? And also, what is that diagnosis really? So what's going on? And have you picked up on any emotions that are in the scenario? And is there anything else that you've noticed? Okay, now I'm just going to get you to answer those questions. I've got 3 minutes here on our little clock, and it's working well. Good. And pop your answers in the chat box, and we can share them, we can look at them. I will definitely be looking at them. And, you know, keep in mind this sort of analysis, because it will help you. Thanks, Cowan. Cowan, your record app ready? It's a bit early, but we will use it. So, come on, everybody. I haven't seen. Oh, well done. Thank you, Juliet. Good. We're in the hospital, yes. And Christian, and the pediatric ward, yes, Adium. Okay, Rashid's got a whole bang lot together. Thank you, Florence. Maria, yes. And Chris. Remya, beautiful, the whole lot. And Princey, thank you. Good. So that's the first thing we need to do. You know, what's going on in our preparation. as you see on the task card, when there is something that is quite rare, like biliary atresia, again, you know, wow, thanks everybody. It's not a test of your medical knowledge, don't forget. And so that is explained. Because you might need to know that, you know. As a doctor, you're going to need to explain it to the parent. That's right, definitely, Victoria. Yeah. Gisem, hi, lovely to have you with us. Vicente, Beautiful. Ida, good. Yes, so, perfect, everybody. That's a really, really good job. So that's job number one. We're in a children's hospital ward. So, you know, as I say to a lot of people, many of your speaking tasks are in, what do you call those places? GP surgeries, yeah? So, you know, the atmosphere is a little bit more familiar, let's say, whereas in a hospital ward, things, okay, it's a children's ward, certainly not unfriendly, but perhaps things are a little bit more formal than they would be with the family doctor. Who is the doctor speaking with? Of course, well, we've got here the mother of the parent. I don't think it's actually the mother, but the parent of the patient, better, because there are plenty of male interlocutors out there that will be playing the role of the father. How old is the patient? Yes, 1 month-old boy. Is the diagnosis established? Well, the most probable thing is that biliary atresia. Okay, and it's a rare and serious liver disease where the bile ducts to the liver are blocked, damaging the liver and making it impossible to digest fat. So all that information is there for you. Emotions, possible anxiety, that feeling of, yeah, and well, who wouldn't be? Anything else you notice? Well, yes, they did talk about there is a good prognosis when there is the surgery. Okay, so that's something, you know, we're looking for something positive in there to sort of bring the parent, that anxious parent, around. Now, the next thing we need to analyze are the key words there, are action function words, because this tells you what you're supposed to be doing, definitely, and they are vital. So they are usually at the beginning next to the bullet point. However, there are very often ones further down within the sentence. Mohammed, that's very interesting, my darling. I doubt if it's very functional. Mohammed said, could he explain by drawing while talking? You could pretend that you were drawing if you feel more comfortable. If you're one of those doctors that draw things, you can definitely pretend. Let me show you here on a pen and paper. I will just draw what it looks like, but still don't forget, you will need to verbally explain the process. Okay, but if you feel that, yes, because we want the role play, well, they want the role play as real and as natural as possible. Yes. Now, just quickly, a couple of. So that was a very, very good question. So should we expect also ask me what I mean by elevating exam? Victoria is. Hang on, Victoria. Victoria is just telling us, and it's so lovely that you've joined us. She's one of the lucky ones who took her exam. Was the 16th of May, wasn't it, Victoria? In my speaking task, the interlocutor asked me what autoimmune disease, as he didn't understand, or what is autoimmune disease, as let's say the parent or the patient didn't understand. Wow, okay. Such questions should be expected, and also asked me what I meant by elevating his arm. I had to explain in clear, simple terms. Well, that's very interesting, Victoria. So guys, that's something that as you prepare or practice, think about some of the things, expressions, or things in your speaking, and think about, you know, right here we've got perhaps here, because the parents were saying that his jaundiced appearance. You might be saying to the parent, your child, yes, is jaundiced. And, you know, the parent might say, well, what is jaundiced? So you need to, you know, talk about the yellow or whatever it is. So think about, from now to your exam, simple ways, not medical ways, for lay people, how you can explain some things which, of course, you take for granted. Okay, that might not be in the task. And don't worry, of course, if you don't know what they mean, you can just say whatever you think. There's no obligation for it to be medically perfect. If you didn't know, you know, what an autoimmune disease was, well, you should do really, I suppose, in a way, but keep it simple. Anyway, don't forget, you're speaking to a patient. Yeah. Shall we introduce ourselves also in the wards? Yes, I would, you know, because doctors come and go, people come and go. It's a ward. It's, you know, it's not that you've come back to see your GP. So that is definitely something. Yes. You can, I suppose, Callum, if you want to do that, you could do it on the back of your card if you want. You will have a paper or your own, you'll have a card, and you will have your own pencil. So you could use the back of your card. Yes, why not? But don't spend a lot of time drawing, you know. Yeah. My task, Victoria, included examining a wound to confirm a fracture. This is Victoria again. To examine a wound to confirm a fracture. So I said something like, can I examine your arm? Oh, there's definitely some bruises and swelling. Well done. Yes. There's Chris. How well did the yes, we're all very, very interested, Victoria. Definitely. It's like a person's immune system is killing its own antibodies. That's a great way of explaining. Yeah. So have it clear in your mind. So not that, as I said, not that it's a medically, you know, you've got to get it medically correct, but that you speak clearly and you can speak without hesitation. For sure, Lydia, my live class is always recorded. Think about the time. They should put both on. That's interesting. But the time will look strange because it'll probably be your time or it's my time, which is 1500. So I'm not quite sure about what time comes up on yours. Your time or my time. So it's 1500 AW Australian, Western Australian time. It should be there, definitely. If it's not, I'm going to complain. Thank you for that. What if we don't have idea what the meaning is? Will the meaning of the it should be, Anna. As I said, they say it's not, but Victoria can verify that. Victoria, was the expression autoimmune disease explained on your task card? Just like lupus, of course, all those sorts of things. Explained at the end of the test. That was said to speak a bit fast. Oh, well, They shouldn't, Yasser, they shouldn't ask you things. Yeah. Okay. Just quickly looking at all those comments. So it was not explained. Interesting. They shouldn't really do that. But, you know, as simply, as I said, for me, and that's what they say, you know, it's what you need to do is to be able to speak clearly and to get it, to feel, let's say, there's good flow of your speech. So let's quickly then focus on our task words, the function words, and I've got lots of answers, so thank you everybody. So the first one is advise. Now, beware everybody, one of our big spelling mistakes, advise is the way we spell the verb. Advice, and has a different pronunciation, is with a C, which is the noun. Let me give you some advice. But I'm going to advise you, and it's got the sound of a Z. Well done. Advise the parent of the likely diagnosis. And then you do have this one. Yes, some people miss that one. Provide a brief explanation. Okay, it's there. Use their explanation. Guys, you do not need to paraphrase it. Okay. You might, you know, you don't have to say exactly. So it's a liver problem. Okay. And you know, you could sort of, where the bile ducts to the liver are blocked. So you know, and that can cause damage to the liver, and it makes it really hard for the body to digest fat. So use those words, but you could just twist it around a little bit. Explain that the condition can be, explain that it can be congenital. And then you've got the other things. Reassure the patient is the other one, and answer their questions. Okay, now answer their questions because they're going to be asking you things. Explain that the prognosis is good with surgery, and you need to outline the risks of surgery, of course, and emphasize the benefits, but emphasize the benefits. So, you know, we need to come out with a positive feeling for that parent. Right. So there's a lot there. So I'm just going to quickly look there in the. Oh, beautiful. Victoria's. So I hope everybody can read it. Not amazing. So well done, Victoria. Yes. We have to use layman language. Yeah, for sure. And that's something, you know, when you, in your preparation from now onwards, think about layman's terms for something that, you take for granted, but you need to explain it better. So that was interesting. Yeah. But as I said, if you don't know what it is and you can make something up, you might say, well, it's a disease that, there's no bacteria, you don't catch it, but it's something that comes from within inside you. Silly like that, as I said, you are not marked on your information. So I've had another, what I wanted just to quickly say, because I like this, answer their questions. I've had a few mini mock tests recently, and the people, the students have forgotten about the presence of the patient, and they just go right through them. So in a couple of minutes we're finished. Never asked me anything. I might have tried to say something, never asked my opinion, never asked how I felt about what they said, never asked me anything. And of course it's a huge mistake, a huge problem. So remember, between every bullet point, your poor little patient's going to say something. And don't forget to ask them always, get their feedback, see how they feel, encourage them to give you that sort of feedback. Now, lots of verbs today. This is a long one, you might not get it finished. No problem with that at all. So we've got advise, provide, explain, reassure, explain again, outline, and emphasize. Hard one. Now let's have a go with some practice. We're starting off. Now, before we start off, I'm just going to have my weekly chit chat about how you think we should start this one. Let me go back here. How do you think, as the doctor in the children's hospital ward, how would you start it? What would you say to that parent when you approach them and their little child in hospital? Lovely, lovely one, Adian. So, guys, the chat line is open. I'm going to spend a couple of minutes on this. How would you start this as a doctor, guys? Sorry, nurses, you're doctors today. What even as a nurse coming up? How would you approach that poor anxious parent? You're going to start explaining them. They were admitted to hospital yesterday, so it's the next morning, but there's no reason that you've seen them. They might have come in and done tests down at A&E. So, you know, you haven't seen them before, but you do have the tests. So what would you say to them? So before that, Christian, my darling, before that, how would you, Carol would introduce them, how are you? And then that your son has a condition called blah, blah, and any idea what it means? Good, good. Okay, well, that's really a bit even the advise bit. So you would introduce yourself. Perhaps it might be worth asking them, I'm Florence, yes, and I'm of good. That I would like to discuss Jamie's condition with you today. Beautiful, Florence, fantastic. Thanks for visiting me today. Rashid, the patient or the parent isn't visiting you. Okay, so that doesn't work there. I'm so glad you wrote that, Rashid, because that would be fine if you're a GP and you are, you know, someone's coming to talk to you. Definitely wouldn't work here, Rashid. Okay, so you have to introduce yourself. Lovely, May. Yes, good, nice one. You've got, and that's what I like. Give the child's got a name. You know, how is Jane feeling? What? Yeah. Or how was Jane's? How did the night go? How did things go last night? That sort of thing. Yes. That's lovely, Farah. Yes, that I'm the doctor's pediatrician, and then we've got the results. I've gone through the case details and the reports. That's absolutely fantastic, Farah. Beautiful. So the patient knows who you are and what's going on. There we are. Now we're going to start with the advising the parent of the diagnosis. So you've introduced yourself. You've come up to them, you've mentioned perhaps their name, you could use their surname or their first name, or you could just say, good morning, you know, I'm Dr. Judy, so you must be Johnny's mother, is that right? Yes, I am. Well, how did Johnny pass last night? How did things go last night? But now I've got the tests, we've gone through all that, and I want to just tell you all about it. That sort of thing. Okay, so think about that each time and do not have that formal one that works, but nothing works all the time. Okay, now we need our phones. We need to do that. We need to advise the parent of the likely diagnosis and provide that brief explanation of, in fact, what it is. You can go very simple. You can go a little bit more in detail. Everybody depends how you feel. Yeah, you can just go very basic, or you can talk about ducts and pipes and livers and damage and all that sort of stuff. It's entirely up to you. But I'm going to give you that minute to plan it, plan what you're going to write, and lovely one, Mohammed. I just read what you said. And Aida? Fantastic. So we're advising the parent now of the diagnosis. Time to record yourself, everybody. How did it go? How did it go? Hopefully you got it done in time. In fact, don't forget, there is absolutely no issue. That what you're going to say now is 30 seconds. And Farah, not is having a disease. One of the biggest mistakes I find also in English, when we use the present continuous tense, well, we can't use it with have when it's something we're talking about possession. We can only use the present continuous when we're talking about something that's happening, like I'm having dinner, I'm having a shower, I'm having a bath, I'm having a lesson, because you're actually doing something. But the verb have, in theory, is a stative verb which has no action. So we cannot use it in the present continuous. Okay. Right. Princey, can you explain about your son's feelings? Not really. That bottom bit. The beginning's fine. So how was he last night? Yeah, think about, because it's the next morning. Or how's he doing today? Okay, some people have written it down. Yes, so Farah, malabsorbed, I can't even say it, is a little bit over the top probably for a simple person. Malabsorption, it's even hard to say. They probably wouldn't know what that means, so it would probably be a bit over their heads. Congenital. Okay, just be careful on your vocab. You need to keep it simple, everyone. All right, let's have a look what our lovely nurse Colin said today.
Okay, Mrs. Smith, thanks a lot for bringing Oliver in. I'm glad you did. Obviously, his colour did look a little funny, that jaundice look. And we've run the test, and it looks like what Oliver's got is a condition called biliary atresia. What that basically means is that Oliver's liver isn't able to process, to digest fat in the way that a normal liver would be able to.
So, in fact, it's very, very simple. It was a bit quiet. I'm sorry about that. The sound, I can't unfortunately adjust it, very, very much. So I just wanted to just focus on a few things. So it's quite interesting what we've got here. We've got, it's not the what I want. We've got a couple of expressions here where very useful when we're talking about the explanation. It looks like what Oliver's got is a condition. Okay, and this is another one to make it into basic explanation. What that basically means is, so throughout the speaking, pick up some good phrases, that might be useful. It looks like what he's got, it looks like what you've got is, and what that, you've given the name of it, what that basically means is, and then you say it. Okay, now let's have a go. Explain the prognosis is good with surgery. 75% of patients have good bowel flow, 25% require a liver transplant. So it's a bit frightening, the whole thing. However, we've got to keep our patients calm, and we've got to focus on the easy way out, that all about the surgery. Mm. Thanks, Victoria. Off you go with your how did that one go? You want to be sort of uplifting in a way. Okay, and Victoria said it's good to address the baby by name, and you see Colin did there. Nice one. Nice one, Victoria. Thank you. Just quickly reading what people have said here. Okay. Nice. Thanks, everybody. Well, people who didn't record would be better because it's all in the words, but I still accept that. Let's have a go.
No, I appreciate your concerns about your son so young having such a condition, but the prognosis is really pretty good for anyone in Oliver's position. And what we think is that with surgery, and this is our experience, that most cases end up letting the patient have good bile flow, and a minority of cases may require something more serious, say for example a liver transplant, but the initial prognosis is very positive.
All right, I just want to play that again. I can. And hang on. Sometimes you can go back. There it is. Just to focus on Colin's use of intonation, round the blue ones.
No, I appreciate your concerns about your son so young having such a condition, but the prognosis is really pretty good for anyone in Oliver's position. And what we think is that with surgery, and this is our experience, that most cases end up letting the patient have good bile flow, and a minority of cases may require something more serious, say for example a liver transplant, but the initial prognosis is very positive.
Okay, you see, so he focuses on those things. Pretty good. Most cases, good bile flow. So throughout that, the key words keep popping out, those positive words. And I hope that your the way you spoke also did that. We wouldn't use Farah, we wouldn't use master. No, we don't use master. It's far too, just go straight for the first name. Good. Fantastic. That's a nice one, Florence. Yes. Good. So we don't use a prefix for boys' names, just the names, Farah. Thank you for that. I understand. Yes. So we wouldn't use master or miss. No, just their names. Okay. The R and the why we put that there, it's just to show that's Colin hesitating. Natural, no more than normal, and those are certainly not going to be marked down. If you sort of say, I appreciate your concern about your son, that would be, you know, difficult. But a little and we use it, people do it all the time, about your son because that's sort of almost natural, but there's not a long hesitation. So that's just, you know, pretty simple way of seeing it. Now, just a couple of more things there. I'll tell you what. Yeah, probably. Yes, fine. Probably a little bit clinical, Rashid, because of course it's written. You need that bit more warmth and encouragement to those parents. It's quite a serious thing, a 1-month-old baby needing surgery, but the positive outcome and the you know, is what we need to focus on all the time. Okay, luckily it's not one of those giving bad news stories. Okay, now let's have a quick look about all the criteria. Now we've got the linguistic criteria, which is about the language, of course. Things like intelligibility, fluency. I'm just looking outside. It's raining. Got my washing on the line. It was sunny before, not there. Fluency, appropriateness, resources of grammar and expression. Okay, so that's all about the language. Then we've got the clinical communication criteria. Now, the linguistic ones are important. They're worth 6 marks each. The clinical criteria are also extremely important. They are, I mean, in total worth 15, but fun enough, they're so integrated that getting those things wrong mess up things like, or you know, the intelligibility or your grammar, your expression. So it's all about how you speak to the person and also what you say. They're very connected. It's very hard to separate them because one affects the other, of course. So the criteria for the communication is building relationships, understanding and incorporating the patient's perspective. Yes, people forget this all the time. How does your patient feel? Patient-centered, everybody. Providing structure, making sure you go through the whole thing clearly. Giving, well, gathering information from your patient, and of course, then giving information back, listening to their questions, answering them. Okay, now, today we're going to look more about the intelligibility, how clearly you can be understood. Okay, now pronunciation, intonation, stress, rhythm, accent, all those things are important and they make a big difference. You know, you use them as we saw Colin doing. Farad, your son has a disease. I'm just looking at the case notes here. Good, thanks, Victoria. Can we use verb that is more natural, meaning not so formal? Verb rather than what, Vincente? Of course, you can use a wide variety of verbs. So let's work on question tags. Oh, my favorite. Okay, now we've got to record yourself. So guys, everybody get your phones out or whatever. And I want you to record them as naturally as possible with those question tags. I'm not going to say them. How will you say them? Come on. Say it a few times each. Try different ways. I wish I could hear you all. Sorry. So you've recorded it. I want you to listen back to it and see, well, compare it to this one. So listen to and repeat these sentences. using the appropriate intonation. Okay, number one.
It's too late to change my mind, isn't it?
You say it.
It's too late to change my mind, isn't it?
Okay, interesting. That question tag has gone down.
If bone marrow transplants were simple, we'd be doing them all the time, wouldn't we? If bone marrow transplants were simple, we'd be doing them all the time, wouldn't we? But we should treat all patients with respect, shouldn't we?
This is the difference, everybody.
But we should treat all patients with respect, shouldn't we? There's no point keeping his respirator going now, is there?
It's a bit sad.
There's no point keeping his respirator going now, is there?
Last but not least.
So, let's have a look at this lump, shall we?
Oopsie.
Let's have a look at this lump, shall we?
Sounds so much like a doctor, doesn't it? Today, so how did you all go? How did you all go? So we've got the two different ones. Funny, huh? We've got sometimes they go down. When the question tag intonation goes down, we're saying something. We call it a rhetorical question. So it's a question that isn't a question. In fact, we're making a statement, but we just want to get a bit of emphasis on that statement. It's too late to change my mind, isn't it? And you'd say, yes, it is. We'd be doing them all the time, wouldn't we? Yes, we would. But this one, when we go up, we're asking a question. But we should treat all patients with respect, shouldn't we? So we're asking a question to get an answer, really. There's no point keeping his respirator going now, is there? No, it's not. So it's sort of going to agree with them. And then, so let's have a look at this lump, shall we? So instead of saying, shall we have a look, let me have a look, shall we have a look at this lump? We say the sentence and we put the question tag at the end. All right. Plenty of work in grammar books and on our website, on the key core skills of your student page, on the E2 school, and any grammar book. There's lots of work on question tags. Why do we use them? Well, we use them to turn a statement into a question. That's not true. That's not true, is it? Okay, instead of saying, is that true? Yeah, we want to sort of, you want to make an influence to the fact that it's not true. It does in the way. Now, I used to work in the court, and I remember some of the lawyers, or perhaps a lot of them, or the barristers, who used to use these things all the time talking to the judge because they wanted the influence, in this case, to the negative. And it's quite an influential way of speaking. But, you know, we use them also for other things. We ask the listener to confirm what the speaker already believes. That's the correct payment, isn't it? Okay. Ask the listener to confirm something the speaker is not sure about. Sam wrote that, didn't he? So we're asking a question. Aim to persuade the listener. Now, this is the lawyers. That's not an unreasonable request, is it? Okay. Now, we talked about plural intonation. We use it to indicate the difference between a question and the down one, which is the clarification, to distinguish between direct and indirect questions, to convey information and the speaker's mood, emotion, the attitudes, We've seen that so many times. To draw attention to certain words. Okay, we wanted to make that with before. Make ideas easy to understand, to say, to remember. All this is just through intonation. Indicate whose turn it is to speak. All right, so there's a wide variety of reasons to use intonation. Depends entirely on the situation. So, and I want you in future, if you're watching something on TV or speaking to somebody even, think about the invitation, the intonation they're using. So let's have a go here. Read the text below and record it up to 15 seconds. Now, the ones that are in black, in bold, draw attention. Okay, and why we're doing that here is because this particular patient, Mr. Jones, dear me, there's a big machine outside, sorry, chewing up a tree. Typical, isn't it? That fell down in the terrible winds we had on Sunday and Monday. So I've told, we want to draw attention to certain words. Now, this one, because the patient is not following our advice. So we've got 15 seconds to record yourself. Sorry about the sound. How did you go? Now, let's listen. I can't even make the sound higher. Get my mouse back. There we go.
Now, Mr. Jones, I've told you many times, you've got to use the Dovenex every morning and every evening, otherwise your psoriasis isn't going to improve.
Okay, so we're making an emphasis.
Right, Mrs. Brown, I just want to understand, these injuries that Michael sustained, did it happen when he was playing sport or?
So let's have a go. Here we are trying to, we says seek clarification. So I'm sorry, I'm just so distracted. We're trying to understand what's going on. We want to get an answer from Mrs. Brown. Have a go yourselves, everybody. Now, Mrs. Brown's explanations of her son's injuries have been contradictory. So they haven't been, she hasn't been very clear. So we need to repeat it and make sure we get it right.
Right, Mrs. Brown, I just want to understand, these injuries that Michael sustained, did it happen when he was playing sport or did it happen in the garden?
Sorry about the sound there, guys. I can't do anything about it. I've just taken a note. It's Mrs. Brown. Let's hope the next one, especially with the back sound behind me. Oh, let's just quickly go through all the strategies again. There's a lot of things going on. Let me just a quick look. So Victoria, which questions need a rise or down? So when we want to clarify something, we make the intonation go down. That noise is really annoying, isn't it? Okay, so we want to sort of emphasize that. If I want to make an assent, if I ask you, that noise, is it bothering, or no, that noise is bothering you, isn't it? So I'm trying to ask you. So the up and the down, yes. So, look, anybody wants to have a study group, or well, we're going to have study groups, or if you want to practice your speaking together, please chat on the line. It's really nice. Unfortunately, the sound is hopeless. Okay. Good. Rashid, Victoria, I want you to concentrate in the class. Victoria, I'll send you out of the class because you're disturbing everybody. Oh dear. So let's have a go here. Now let's just quickly talk about the strategies. Guys, we're back at the beginning now. So we've got to think about our role play. And as we've said, you've got to imagine that you're with a real patient. So your interlocutor, that's why it's good to use their name, male, female. And another thing to focus on where you are. So you're with a real patient in a real place. And that makes a big difference of things like formality, etc. So it's very important. Don't memorize long answers because it just doesn't work. We did talk about a couple of phrases before, remember, when we were explaining things. Very, very useful. So you can make a list of all those little explanations, but, you know, just using them, but in the right context, of course. Take a deep breath and smile and look at your interlocutor before you start speaking. Now, this is your preparation. Underline the key words and the phrases on the card, guys. Make sure that you've got the card and the information clear in your head before you start. You can make some brief notes for each point if it's going to help you. That card is yours to do whatever you want. Ask the interlocutor during the beginning to clarify anything in the role play which is unclear. Perhaps it's the meaning of a word, of a phrase, you know, the pronunciation or the context. Doesn't matter. It's before the role play begins. Your chance, you can say whatever you like. Read the role play carefully. Make sure you avoid misunderstanding or missing out any topics. Makes a huge difference. Now, your ability to communicate effectively with patients is being assessed, not your medical knowledge. So even if they ask you, explain to me what is autoimmune disease, if you make it up and say something completely different, what they're looking for is, can you explain something? Whether it's a process, whether it's about something. So, you know, what you said about the autoimmune disease doesn't really matter. But the thing is, have you explained it? Have you communicated effectively with that patient of yours? And pay attention to the type of information you need to give and adjust accordingly. I mean, do you need to give empathy? So you need to speak in another type of way. Do you need to show understanding? Do you need to show assertiveness with, like Mr. Jones with the psoriasis, about taking the medication or putting on the cream at the right time? So you need to change your voice, etc. Now, you can, once again, while speaking, remember we've got the card. You don't need to paraphrase. You need to sort of change it a little bit. You're not reading off the card. But you need to vary your vocabulary so that it's appropriate to the needs of the patient and the context. I mean, if you've got a very, very young patient or, you know, a teenager or something, you need to be a little bit more modern or less serious than you would be with someone who's much older. So take those things into consideration. Show that you can communicate in a variety of ways. Speak audibly and confidently, and pronounce words clearly and correctly. Okay, so all those things count. Don't forget to ask your interlocutor if there's a word you're not sure of the pronunciation. And vary your intonation. It is a very important tool to emphasize, to explain, to calm down, to show the good points. There's lots of different reasons to vary your intonation. And establish relationship, the correct relationship with the patient before you ask the relevant information. So get that right. Introduce yourself, ask their names. If you know their names, address them. You know, if you want to ask them how things have been since they saw you last, think about it. Think natural. Don't think, oh yes, I have that standard one and I'm going to say that. Doesn't work. Okay. Now, and finally, you don't have to complete all the tasks. You know, that one we had today was a long task. There was a lot in it. And don't forget, half of the time, your patient or your family member is speaking. So it's not 5 whole minutes you're speaking. Is it 2.5? Is it 3? The other time, your patient is speaking. Make choices. Consider who you're speaking to and how that affects your language choices. Here we go. Balance speaking and listening. Oh yes, don't forget. Respond to what the patient says. They ask you if you need to clarify some information.